Welcome to this month's newsletter. Few departments within a hospital influence the efficiency and effectiveness of other departments as much as the emergency department does. By demonstrating high quality, efficient, patient-centered care, the emergency department is uniquely positioned to provide leadership for quality improvement initiatives. Shortly, you will hear from our two emergency medical directors, Marsh Cutno and Dan Angeli, and from our pediatric emergency room medical director, Kevin Connolly. Over the past decade, emergency departments have been challenged with overcrowding and increasing public focus on quality improvement and quality measures. We routinely measure ED quality and operational performance measures. These measures are publicly reported and directly impact our Center for Medicare and Medicaid Services hospital rankings. The Center for Medicare and Medicaid Services ranks hospitals on a system from 1-star to 5-star. You should be proud to know that Henrico Doctors Hospital is only one of 3 hospitals in the Richmond area with a 4-star ranking. And we are the only hospital of the 17-hospital HCA Capital Division with a 4-star ranking, thanks to the great quality of care delivered at Henrico Doctors Hospital. The 7 metrics that the Center for Medicare and Medicaid Services utilizes based on mortality, readmissions, safety of care, timeliness of care, effectiveness of care, effective use of imaging, and patient experience. 2 of those measures, timeliness of care and effectiveness of care, are directly tied to the emergency department. I would like to thank you for the medical staff participation in our 4-star ranking. It's a direct consequence of the medical staff engagement with our emergency department physicians and engagement with Henrico Doctors Hospital quality improvement initiatives. I would ask each of you to reach out to myself or any of the medical directors with any comments or suggestions for continued improvement.
Hi, I'm Dr. Kevin Connolly. I'm the medical director for the Pediatric Emergency Room here at Henrico Doctors Hospital Forest campus. We have a pediatric emergency room here, staffed with fully trained pediatric ER staff. All of our staff are certified in pediatric advanced life support and advanced trauma life support, so we can provide care to the sickest of children. We have 5 beds down here with our pediatric nurses, and we're fully equipped to take care of any kind of pediatric emergency. In fact, we just scored 100% on the National Pediatric Readiness Project, where the average hospital scores 69%. We were at 100%, so we're ready to care for any type of illness or injury a child might receive. All the children down here are seen by pediatric trained physicians. We have a full range of pediatric subspecialty care. We have an inpatient unit and a pediatric intensive care unit. One of the things we pride ourselves in is keeping the local pediatricians in the loop of their care of their patients here in the emergency room. Oftentimes their patients will arrive in the middle of the night and call the next morning, and they aren't aware that the patient was in the emergency room. Here at Henrico Doctors Forest in the pediatric ER, we fax over our notes to the office so that you will be aware of the patient that was seen here, what was done, and be prepared to continue their care. Besides the ER being staffed with pediatric emergency physicians, we have inpatient pediatric hospitalists and pediatric intensive care physicians that are on staff 24 hours a day. We do a lot of training with local EMS providers, specifically in Henrico County, so that continuity care can occur from the community through the pediatric ER, and then if patients are admitted to the pediatric hospitals with the pediatric intensive care physicians, and then back to the pediatricians. In preparing for our pediatric readiness assessment, we've gone to be an ouchless emergency room so that we have needleless systems to prevent needle pain and sticks. We do intranasal medications, and we do this to help the children with their fears of painful procedures and just the fear of being in an emergency room.
Hello, I'm Marsh Cutno. I'm the medical director at Henrico Doctors Forest, Hanover, and West Creek Emergency Centers. I'm also the chairman of emergency medicine at the Henrico Doctors Hospital System. I want to let you know about how proud I am of the emergency services we provide here at the Henrico Doctors Hospital System. Emergency medicine has changed over the last few years. Quality metrics are very important to us here in the Henrico Doctors Hospital. We are continually evaluating and working to improve our system. In emergency medicine, time is our most valuable commodity. We are the Minutemen of medicine. We do emergency medicine quickly and with high quality. Over the last few years, we have implemented several new programs, all designed at increasing speed and quality. We have added trauma, and we have continued to improve our cardiac and stroke programs. We have excellent metrics that demonstrate that we are able to provide a rapid and appropriate assessment of our emergency patients. We continue to provide excellent care in sepsis, and we're one of the first hospitals to be recognized by JCAHO as a sepsis-designated disease-specific hospital. We also recently achieved Level 2 trauma certification by the state, and are looking at Level 2 accreditation by the American College of Surgeons. These programs have enabled us to provide additional services and improve quality in the emergency department. At the same time, we are able to rapidly examine our patients. Our goal is to see every patient in less than 10 minutes. Our goal is also to have patients dispositioned, whether to go home or be admitted, within less than 2 hours. We are able to do this by continuous quality improvement and continued analysis of how we do our medical care. We do a deep dive into any issues that we have. If you have any questions, please reach out to me and let me know. Due to our excellent quality of care and the excellent reputation of our specialists, we are receiving increased transfers from outside hospital systems. We do the best that we can to get those patients into the ER as rapidly as possible and then get you, the specialists, involved. It is our goal to make sure that we are able to get them to definitive specialty care as soon as possible.
Hello, I'm Dan Angeli. I am the Medical Director for Emergency Services at your Parham and Retreat campuses. Look forward to working with all of you here. At these campuses, we have well-based, well-trained physicians, community-based EDs, and we run a gamut of specialty services at those institutions. I look forward to taking part or working with all of you in a collegial fashion. Please, if you have any recommendations regarding the emergency department, I can be reached through the Parham ED or the Retreat ED at any time. Love to hear from you. Love to speak with you in regards to how we can serve you better, because our physicians on staff and our community-based physicians certainly are our customers. At the emergency department, we see probably 150 patients a day at those two institutions. So we take care of many patients, many of your patients in our ED. We look forward to your conversations where you can call us and let us know what may be coming our way or how we can work better with you and how we can better take care of your patients. Through those EDs, we probably admit half of the patients to the institution every day. And so we have great services at the hospitals we're at, including surgical care, in bariatric surgery, orthopedic surgery, and at both those institutions we have behavioral health services that are second to none. Also, we have great triage services so that we can better assist and get people over to a tertiary center here at Forest. We do that quickly, efficiently, with great relationships with our colleagues here and our EMS systems, so that we can get people here in a quick, efficient, and certainly quality and patient safety directed care.